chose the topic because I had been working on adoption earlier, and adoption in many ways, not completely of course, is a good news story. But when I turned and thought of the great mass of children who come into the ambit of child welfare authorities, either private or public over the years, very great majority are in foster care. And their stories are often, not always, but often far more difficult than those of the children who go into adoption. So their stories really cried out to be told, and of course they are a major issue in social policy today. You can rarely open a newspaper without some mention of a child being abused or a problem with the foster care system or overworked social workers. So it really, I think, demanded our attention as scholars. I think there are signs of hope. It's really easy to come out of these stories and feel just utter despair. I think there are four areas of hope. One is in First Nations getting control of their own child welfare policies. Secondly, a feminist analysis which really point to the burden of care and how it needs to be addressed, and it's borne disproportionately by women. Thirdly, I think we see social workers across the country, and there is a continuing tradition of this, looking to the development of communities, because children can't be looked at as individuals, although they must be looked at that way sometimes too. But we have to look at the capacity for care within the community, and social work, I think, really is addressing that, or trying to within their very limited budgets. And fourthly, we see that there is a protest movement among survivors of the foster care system, so that you see children who've often had dreadful personal histories, really asking to be heard or even demanding to be heard, and their stories can be told far better by them than indeed even by scholars such as myself. I think caring labor is something that we see about us all the time, and we benefit from and we give it. But the feminist scholarship has really pinpointed it as a central part of who we are as human beings, and that women bear disproportionate responsibility for caring labor, whether we're looking at children or the elderly or people with disabilities, and that it has often been assigned to the private sphere, as if the private sphere could take full responsibility for all the difficulties of the public sphere, which throw people out often when they're facing difficulty. And women have been expected to bear these responsibilities. And we see this in the child care system, where women as foster mothers, women as social workers in particular, have had to really deal with children whose terrible predicaments are very much a responsibility of the unequal distribution of power and resources in our society. I think policymakers need to, and some have. I mean, we can think of Stephen Lewis, for example, but there are other policymakers as well who have been important in making sure that children stand to the front of who we think of ourselves when we think of ourselves as a society and a community and as a caring community. That if we're not doing well by our children, then we're not doing well by the future. And certainly today, when we're looking at, the generational divide, and there are all sorts of questions about where resources are going to go, I'm really very concerned when we see young families, families with young children being put under tremendous pressure and without a national daycare system. My advocacy would be really very much around a national daycare system. That will take off some of the pressure on very vulnerable families and ensure that their children get the best start.